Hi, and welcome back to Abnormal Psychology. We're going to look at treatments for anxiety disorders, part 3. Now, this is the last part for anxiety disorders, and this will be the way the videos we're going to continue to go. We're going to try and do them all in 3 parts: description, theoretical perspectives, and then treatment. Okay, let's get started, and we're going to start with the psychodynamic approaches. Now, each theoretical perspective here is connected with methods of treating anxiety disorders. They encourage people to face the sources of their anxiety rather than to avoid them. We'll start with the traditional psychoanalysis, which helps people work through unconscious conflicts that are thought to underlie anxiety disorders. Now, as we have mentioned earlier, it's kind of hard to get to some of the roots through a more traditional psychoanalytic approach, but more modern psychodynamic approaches also focus on current disturbed relationships and encourage clients to assume more adaptive behavior patterns. The humanistic theorists, they suggest that our anxieties result from the social repression of our true inner selves. Anxiety stems from the incongruence between our true inner selves and the presenting social self that we have out there for others to see. Humanistic therapies aim to get in touch with our more genuine self, to know and accept and to be our authentic self. Now, biological perspectives are going to be common in all, if I remember correctly, of all of our psychological disorders. The biological perspectives have spawned the development of various drugs to treat anxiety. Antidepressants have had an effect on anxiety in addition to depression by normalizing the activity of neurotransmitters in the brain. More recent success with serotonin norepinephrine reuptake inhibitors. They're also known as SNRI. Obsessive compulsive disorder responds better to selective serotonin reuptake inhibitors, and that's SSRI, as it assists with the serotonin transmission, possibly responsible for the development of OCD. Drug therapy is not a one-size-fits-all and often will do better in conjunction with cognitive therapies. So let's touch base, cognitive and behavioral approaches. And we're going to start with the learning-based approaches. Learning-based approaches encompass a broad range of behavioral and cognitive behavioral techniques to help people overcome anxiety-related problems. Exposure methods help people with phobias overcome fears through gradual exposure to the phobic stimuli. Cognitive restructuring helps clients pinpoint self-defeating thoughts and substitute with more rational alternatives. Obsessive compulsive disorder is often treated with a combination of exposure and response prevention. Relaxation training is often used to help people with generalized anxiety learn skills to self-relaxation. Behavioral treatments of PSTD incorporates progressive exposure to traumatic-related cues and training in stress management skills such as self-relaxation. We'll now move into the cognitive approaches such as rational emotive therapy and cognitive therapy help people identify and correct cognitive errors that give rise to or maintain anxiety disorders. Cognitive behavioral approaches to the treatment of panic disorder help people with a proneness to panic disorder to learn to cope more effectively with cardiovascular and other bodily sensations. So they learn that when my heart starts to increase, how do I slow my breathing and change my thinking to relax those expectancies. Behavioral treatment of social anxiety disorder can include gradual exposure, less to more, stressful social settings until the urge to escape subsides. Therapist guides the clients at first, and then the client learns to self-talk with more rational and healthier responses. Now, specifically, a behavioral treatment for agoraphobia is essentially along the same lines. Its gradual exposure has had a good and enduring success. And so that strategy of learning new cognitions while gradually being exposed to things you had been anxious about in the past seems to have good outcomes. Behavioral treatments of obsessive compulsive disorder, well, gradual exposure and response prevention. Here it's the expression of effort to physically prevent the compulsive behaviors from occurring. Repeated has minimized the anxiety associated with OCD. Now, cognitive behavioral treatments of generalized anxiety, relaxation techniques, and substitution. Substitution of adaptive thoughts with for the intrusive, anxiety-inducing ones. So it's a substitution. We'll identify what is maintaining the anxiety thoughts, and we'll replace them with new ones. And decatastrophizing. Here's where strategies are used to avoid thinking the worst possible thing that could happen. Now, all of these strategies, for the most part, with the exception of biological, are behavioral or faulty thinking, and so they are doable. We may often, this is why they're often paired, biological and psychological or cognitive behavioral, is that the medication might reduce some of the physiological or even our cognition, slow it down and allow for alternative thoughts to be entered in and used instead. So this is our first example of a psychological disorder. I hope it's worked out all right in these 3 stages in 3 different videos. So we're going to keep going this way. I hope all goes well for you. So good luck, and we'll see you in the next video. Bye now.